Yes, good morning, ladies and gentlemen, here physically present in this room, in this wonderful city of Bengaluru, but also, from what I understand, the thousands of people who are following this conference using modern communication technology. It's my pleasure to be back here at this conference, which I've been following for several years, and I thank the organizers for again calling on me to make a presentation about eHealth in Europe. At this first session, I think it is important to first have a look at the global issue, at the broad picture, and later on through the conference we'll focus down, we'll zoom in on your daily activities and the daily aspects of eHealth. But it's important to put it in respect to the world in general. And then let's focus to the situation in Europe. Yeah. Well, Europe is the smallest continent, as you may know, and with, what, 700 million, which is only, what, 3/4 of the population of India. But with 50 countries and almost as many languages. And if you see these maps, look at the other one with the regions. If there are 50 countries, there are 500 regions, which are all playing an important role, trying to do it adapted to their own situation. In Brussels, the headquarters of the European Union, in fact, exactly this week, there's a big meeting on the regions. And so you see how diversified that is. Cultures, languages, etc. And we are facing, as major issues, a growing demand on medical specialists due to the increasing and aging population. But that's not only in Europe, by the way. The movement of people, and more recently including the immigration, and then the speed of the distribution of pathogens as well. Now, we are also facing the rising of the health costs. 70% of the healthcare costs are spent on chronic diseases, and about 100 million citizens above the age of 15 have a chronic disease. And the forecast is that the cost of health and social care will rise substantially to about 9% of the GDP, the European GDP, by 2050, which is enormous. But again, this is not only in Europe, but Europe is no different. And so the solution is really in the eHealth, and whatever you call it, or whatever part it is, whether it's the mHealth, the telemedicine, the telehealth, it has to serve one major purpose, and that is to reach to universal health coverage, which you cannot just by the traditional means. Using the modern communication tools are playing a very important role in this. So the situation in Europe about the rules and regulations, the challenges are to address the health issues, to answer the needs and expectations, yet respecting the local legislations, traditions, cultures, and economic differences. And all that is in order to increase healthcare quality across and safety by making eHealth part of health policy and by coordinating the EU countries' political, financial, and technical strategies. It also to improve the citizens' health by making life-saving information available between countries using the eHealth tools, and ensure sustainability of all the health systems. So, what has the EU been achieving in terms of policy and supporting actions? The eHealth Action Plan already goes back to 2004. And presently there is another plan which started back in 2010, which is a 10-year plan supposed to end by 2020. And the goal is to move the EU towards a European eHealth area. So it's broad scale. And the specific objectives would be to create an electronic health record architecture, to set up health information networks between points of care to coordinate the reactions to health threats, to ensure online health services such as information on healthy living and illness prevention. Prevention is a very important element. Let's not forget that only 20% of the world population is sick. 80% is healthy, ready to become sick or aging. The eHealth in the EU's legal context. There's a wide range of legal issues that are relevant to eHealth already, ranging across contract law, employment and market laws, and even criminal laws. But three areas of legislation are essential: the data protection and the confidentiality and security, the product and services liability, and the trade and competition laws. You know that Europe is very fond of organizing fair competition. And what has been implemented? Well, it has been through research and development. There are all sorts of programs for quite a lot of money that are running to develop the research and development in this field. The political or policy instruments, the support of deployment, and the work with national health systems. There are lots of directives and laws which have already been set into a legal frame, and here's the list. I'll let you read that at your ease. I'm not going to bother you by naming it all. And a good example also, there are some standards that have come up out of projects. In one here is the European Code of Practice for Telehealth Services. It is important to have such documents to which the players can relate. And here are a few examples. Come on. The point I want to make here is Europe is actually a leader in eHealth legislation. And you see the dominance in various points. The amount of countries with established privacy legislation, established legislation to protect privacy of digitized health-related data. No, come on, please. Hey, come on, technology. Here we go. And furthermore, so Europe is certainly an example and should be looked upon as such, which doesn't mean that it is the solution. It just means that you count with it. Yes, please. And then you find here some links where you can find more details about existing regulations and laws already. So, in summary, Europe, and especially the EU, has done a lot towards wide development and implementation on eHealth. It may serve as an example, as I said, of how eHealth regulation are built respecting the interests of different countries and implementation on international level. Yet Europe doesn't have a monopoly on this, and it is always ready to coordinate actions, share expertise, exchange knowledge, and learn from the rest of the world, because health is truly global. And the challenge for most countries is how to expand the health services to meet growing needs with limited resources. That is to achieve universal health coverage. The whole world, including Europe, faces situations. You know, where's the money? But believe me, there are so many things that can be done with little money, and that is most encouraging. Sometimes we throw too much money at things, believing that the money will solve things. It's not true. That's what I believe sincerely. And with all the amount of diseases around the world, which are all spreading worldwide and quickly, there's no single national healthcare system that is able to dedicate human and technical resources to deal with all. So international cooperation is a key to all that. And to end my presentation, I'd like to say a few words about the International Society for Telemedicine and eHealth, which is a society that brings together national associations and offers a networking platform so that we can learn from each other. We are using for that, well, the website, of course. We have quarterly newsletters, which are spread to more than 20,000 people around the world, and several among you may already receive them. We announce regularly information, we share information with our members through member announcements, and we also created a year or two ago the Journal of the ISFTH, which is an academic journal with long papers, peer-reviewed, indexed, and which is open access. So you go to the website and find that, and if you have communications to make and you wish to send in papers, please feel free, and it is also free. And then two national events that we have. Actually, in 2 weeks from now, we'll be in Rio for our 20th international conference. And then the traditional Meditel, which is going to be already the 14th times next year in Luxembourg, which brings basically 500 people from more than 50 countries together in a program with about 200 presentations. And then, important here, come on. There you go. Can't miss that one. Here we go. Is the free online knowledge resources which you find on the Meditel website, which gathers more than 5,000 abstracts, PowerPoint presentations since 2002. So it's really a source of big knowledge, of grand knowledge acquired through the Meditel presentations, which you find per year, per topic, per country, and also a selection of evidence-based presentations. It is free access, and believe me, you can learn a lot through there as well. And therefore, based on that, there's no need to reinvent the wheel. There's a lot to be done, but it's also very important to share. And I'd like to end by saying, actually, there are two pieces of good news. First of all, there's no way back. And secondly, as we speak, the scope of all this area, all this territory, is not moving in a parallel way. It's moving like that, meaning that as we speak, there are more things happening and expanding. And that's good news, because we'll be busy for generations to come. And I repeat, there is no way back. And let's not forget one thing. It's all about the patients. It's all about the citizens, meaning ourselves. And technology is a tool. It's not a gadget, or it should not be used as a gadget. We have to learn from mistakes as well, and make sure that we use those tools, those great tools, in an appropriate way. That's also part of the knowledge and the education. Thank you very much.
That's great. Thank you. We're going to do our questions and discussion at this point, so please type your questions into your phone. Dr. Ganapathy, you had a question?
Frank, I have one question. We occasionally give teleconsultations to Europe from India. Could you comment on the legality or illegality, number one? Number two, are there any attempts made in Europe under any regulatory agency to have something like an international licensure? In the US now, most states have done away with the cumbersome process of teleconsultation, and today you can get a teleconsultation licensure within the different states in the US. So is there any such move in Europe?
Underneath, I'm sure. In the practical way, there's still a long way to go. You know how politics work. This should be done, and it will be needed. There are some countries who have issued decrees or laws regulating telemedicine. France is probably, or was the first, and can be set as an example. But then there is still so much to be done. But yes, it's there, and we cannot ignore it. And how much the European Union can do about it, I'm not sure, because health is still one of the territories that the nations themselves cover. Europe has nothing to say in social security. I would like to say yet, because if we ever want to reach an acceptable level, the European Union will have to play a role. And of course, there will never be a United States of Europe. It's going to be a sort of federation of many national individual states. It has proven to work well in some areas. Health is more difficult. But again, let time do its work. Time is the only thing you cannot buy or sell. We'll have to be patient on that. I'm optimistic that it will get to it.
Yeah,
Yes, sure.
I'm Dr. Mishra from Lucknow. I think, Frank, we know each other very well. And thanks for coming to India a number of occasions. It's almost a decade you are here. And most important is the promotion that you are doing for the forum that you have created in Europe. There's a knowledge sharing center. It is Meditel, is all about knowledge sharing. So taking that statement forward, the two things that you have said, it is a diverse region in the Europe. I look at it a lesson for us, and India is also like a diverse. We have the similar situation. It's not a United States of Europe, and we always say that India, as a India federation, but we are many countries, diverse culture, language, everything.
Right.
Maybe more than 500 dialects in our language. Two things I want to learn from you. That attending the Meditel meeting, I've realized that the EU has been very active in developing standards, developing law, developing security guidelines, as well as health information exchange models. If you have noted the previous speaker today morning, he said health is everything related to the health information exchange, to the decision, to the good health. Here I want to know that what is happening in EU when you talk of EU citizens rather than citizens of Belgium or England. Regarding the health information exchange, taking Ganapathy's statement again forward, the security. Because you are exchanging the health information across the Europe continent because you have a strong migration happening within the Europe. So what is the impact of that? We have been listening about this thing for the last 10 years, about the EU standards and regulation and security. Can you just enlighten us about that? Because we want to learn from that as far as the Indian health information that is now Bedi and group are working on. the national eHealth standards, and we have authorities coming up called national eHealth authorities. So we want to learn from the European exercise. It's almost akin to the Indian situation.
Yeah, I agree that there is a lot of similarity because India has a subcontinent, actually, with all these cultural differences, languages, same thing that we have in Europe, and which each state, if I understand well, that also has a certain autonomy. Yes, there should be more communication, definitely. And I know there have been attempts in the past between the groups, you know, but is that enough? No, it will never be enough. In international communication is essential. And this is why above the daily tasks that we perform or the position that we have, it is so important to relate to the global aspect of things. This is my message. I'm not a doctor. I'm even less a computer person. But I've learned in this field of telemedicine, e-health, whatever you call it, you know, that at all times, for everybody, anywhere, whether it's here in India or anywhere else, we need to have that vision to zoom out, you know, to see where whatever we do locally fits into that global. Education is another aspect, which I haven't touched here, but which is so important, you know, to learn from what is existing. I've always been, well, I think I've come here for 10 years now. I've learned a lot about what is happening here, and I'm claiming it to other people in other parts of the world. India is an example. And you are probably one of the more advanced countries as far as telemedicine is concerned, although very difficult situations. And so, yeah. But Europe is what it is. It is, you know, that when something is sort of decided in the EU context, each national parliament still has to vote it. And if one doesn't, you know, their whole, it's trying to put up a large building, a huge building, and if one element doesn't connect properly, well. So let time again